In this segment, we're going to be talking about leads management. When you get leads, what do you do with them, right? And what do we do with our leads when we get them? It's all about getting that new patient through the door. Think about it this way. You really can't help anybody until they walk through your door. And you certainly are not benefited until they come through the door. So the new patient welcome sequence is based off of several concepts that are really relational in nature. Okay? So we're building that relationship. So what are we trying to do? We're trying to help them anticipate their appointment. What is it going to be all about? How am I going to get excited about it? What is it that I'm supposed to get excited about? We want to include that stuff in there. We also want them to know what to expect. Okay, very important for people to understand what that is, both in terms of time and in terms of content. What is it that I'm supposed to expect? And then finally, wrap those things up. Now again, very brief. I'm not going to go into the how to do all of this. I just want you to understand that this is the basic flow of the messaging process that's inside of Ava. And is it effective? Does it actually work? Well, we tested it to find out. Does it actually work? What did we look at? 2,604 new patients scheduled their appointments, right? 2,076 actually showed up for those appointments. And so we get about an 80% show-up rate. Now, that's about average, an 80% new patient show-up rate. So if we can move the needle on that, is that important? So 528 people didn't attend their appointment. 58% no-shows, 42% cancellations. Again, is that important? Yes, and we'll come back to that here in just a minute. So let's take a look at what happens if we use the new patient welcome sequence. So 23% of the new patients received the welcome sequence, meaning again 77% did not. They just received appointment reminders. Now, those appointment reminders probably came out of the practice management system. Maybe they were using Ava for appointment reminders, but whatever, they just got those. Okay, so here's what we see. First of all, right off the bat, look at this. You've got an 84% number here and a 77% number here of those who got the welcome sequence versus those who did not. That alone should be compelling enough. So when I look at that, I see, there's 7 people included in that spread. That spread gives me 7 additional opportunities. When I think about the opportunities on a daily basis, if we're looking at, let's say, an 80% start rate, or even on average, a 70% start rate, chances are very good I'm going to get at least one of those 7 to start treatment. So, when you think about, do I have a compelling reason to use the new patient welcome sequence? Sure. I've got a very compelling reason to use the new patient welcome sequence. I've got 5,000 compelling reasons to use the new patient welcome sequence. This is an important component, just this piece right here. But let's go on. Let's see what else there is of value here. So if we look at the welcome sequence, we see a 40% no-show rate and a 60% cancellation rate on those who didn't attend the appointment. Okay? But if we look at no-shows, we see 57% no-shows just on appointment reminders, right? Versus a 43% cancellation rate. Ask your front desk, which of these 2, no-shows or cancellations, is easier to reschedule? It's a lot easier to reschedule someone who's canceled than it is to reschedule someone who no-showed. If someone has completed their new patient forms, is that important? I mean, prior to coming into practice, what is their level of readiness? Readiness for what? Ready for the appointment? No, that's not what we're getting ready for. This entire process is to help them be ready to start treatment. The whole thing, everything that we're doing, is to help them start treatment. Again, you can't help them until they walk through the door. That's step number 1. Yes, I'm ready to start treatment. That's what we're aiming for here. So when we think about what it is that we can do with new patients just by having them complete their new patient forms prior to coming in for their first appointment, it is significant. Now, I'm looking at a practice here who has a very good show-up rate. their show-up rate is right now about 90% on average across the board. That's very good. Now, they're using the new patient welcome sequence. They've done many, many different things that I've helped them to put in place to get these kind of results. But it's a very good situation, right? For patients who complete their new patient paperwork prior to that first appointment, 98.5% show-up rate. Here again, the spread is important. If I get another 8 or 9 people through the door, in this particular practice, that's massive, right? Because in this practice, they enjoy about a 90% close rate, okay? So when I think about getting 8 or 9 additional people in the practice, that means I'm going to get 7 to 8 additional starts of $40,000 just by getting somebody through the door. Now, one of the tools that we have at Ava also for the TCs is what we call a new patient tracker. The new patient tracker allows the TC to know what the readiness is of that patient. So what are the indicators that we have? Well, the age of the patient is an indicator. The new patient forms is an indicator. Insurance verified, those are all indicators of what's going on and the readiness of someone to start treatment. So when I look at these factors and I look at the factors of what we have available, so did they receive the new patient welcome sequence? Yes, good, I can check mark that, right? Did they get new patient forms completed? If they did, we know that's another step. If they said they had insurance, have we verified that insurance? All of these things, the more of those I can check, the more ready they are, the higher and the more attention we want to pay to that particular individual. What about those who just don't seem to ever make the appointment, right? You've got the lead, and they haven't yet made that appointment. What do we do with them? If they haven't made that appointment, maybe they just don't have enough information. So can I add to the information that they have, right? When should we stop sending them stuff? In some practices, if they don't respond to you because you called them left a message, we're done. We're not going to bug them. We don't want to bug them. We don't want to upset anybody. My rule of thumb and the practices that I get to work with is, hey, you know what? If they don't respond, we're going to keep trying. When they respond and say, hey, stop sending stuff to me, then okay, we'll stop. We'll respect when they ask us to stop. But until then, we're going to assume that they want it. They just haven't availed themselves to the treatment yet. Okay? And then finally, you might consider some incentives. Do we have to incentivize people to actually come in and start treatment? Do we have to incentivize people to actually come in for their appointment? Well, in some cases, yes. So you may offer a coupon, you may offer something that would incentivize them to come in. Those are all useful things to consider when we think about what do we do with people who haven't yet made that appointment. So my hope is that through all of this, you understand the importance of developing that relationship and using an appropriate tool to do so. Because I promise you, your team cannot do this. Your team does not have the time to do this. And you don't want to pay enough people to have the time to do this. Ava can do that and do it very simply for you. And that is what I highly recommend.